Any chest pain can be concerning, even scary. But what if it's on the right side of your chest? Is that dangerous? Can you safely ignore that? No. This video is going to help you understand right-sided chest pain and when to freak out and when to relax. Most people think chest pain is only dangerous if it's in the middle or on the left side of your chest, if it radiates down your left arm, or if you're a man. The truth is that heart disease is the leading killer in both men and women. And so everybody needs to take chest pain seriously and understand the different kinds and what they mean. I'm Dr. Ken Berry, a family physician with 20 years of clinical experience, 6 of those years being in the emergency department. And so I think I can really help you understand right-sided chest pain. What's it mean? And at the end of this video, I'm going to tell you 13 causes of right-sided chest pain that'll help you understand this malady better. Any chest pain that's sudden and severe in onset, you need to immediately activate emergency medical services. If the chest pain is accompanied by shortness of breath, by a very fast heart rate, by loss in consciousness or a change in consciousness, difficulty breathing, breakout in a cold sweat, any of these things, you need to activate EMS immediately and not take a chance on that. But what if you're just having right-sided pain and none of these other symptoms, and maybe it's not too severe? What could it possibly be? Here's the list of what your right-sided chest pain could possibly be. Number 1 is anxiety or a panic attack. If you've never had one of these before, then you're not really aware of how severe they can be and how much it can feel like you're going to die. They can be pain anywhere in the chest, but definitely in the right side as well. If this is your first panic attack, you probably should activate EMS just to be certain. If you've had these panic attacks before, then you may be able to use some box breathing or some cognitive behavioral therapy to break your panic attack. Medication is always a third option. Number 2 is trauma. If you whacked yourself on the right side of the chest yesterday, and now you're having pain in the right side of your chest, then yeah, it's probably from the trauma. Traumatic chest pain on the right side is usually identifiable by being able to touch where it hurts. Ooh, it hurts right there. Or if you cough or sneeze, it hurts right where you whacked yourself yesterday. That's probably something you can ignore. Number 3 is a muscle strain. So if you did a really strenuous workout yesterday, or you moved your furniture, then you might have pulled a rib muscle, which can be exquisitely painful. Again, it's going to be replicated by touching the area, or if you take a deep breath or cough, it's going to hurt right there where you pull the muscle. Number 4 is acid reflux or heartburn. Typically, you think this is going to hurt right in the middle, but it can hurt on either side of your chest. And for people who've never had it before, it can, for all the world, seem like a heart attack. If this is your first time having it, you should probably activate EMS just to be safe. Number 5 is a gallbladder attack or a liver problem. Your liver sits right underneath the right side of your diaphragm. Your gallbladder sits right underneath that. You can have exquisite right chest or right shoulder pain from a gallbladder or liver issue. Some of these issues are life-threatening, and so if this pain is severe, activate EMS. Number 6 is pancreatitis, which is an inflammation or infection of your pancreas. The pancreas is on the left upper side of the abdomen, but the tail does come across, sometimes passing the midline, and you can sometimes have pain in the right chest from an attack of pancreatitis. Obviously life-threatening, activate EMS. Number 7 is shingles. And so shingles is a reactivation of the chickenpox virus, and you can have it anywhere on your body. But if you're having a flare-up of shingles on the right side of your chest, it's going to follow your ribs kind of all the way around. It's going to be a prickly, burning pain that you can sort of touch, but not really. It's not dangerous at all, but it can mimic a much more serious inside the chest condition. So I wouldn't blame you if you activated EMS for your first attack of shingles on the right side of your chest. Number 8 is pleurisy. This is an inflammation, usually sometimes an infection of the outer lining that covers your lung. This almost always is going to hurt when you take a deep breath or cough. When you're sitting very still and holding your breath, it usually doesn't hurt very much. Hard to tell if you're not a medical professional, so I wouldn't blame you if you activated EMS for your first flare-up of pleurisy. Number 9 is pneumonia. If you have pneumonia in your right lung, you can have quite severe chest pain on the right side. It's almost always going to be accompanied by fever and coughing, productive sputum, shortness of breath. EMS is not out of the question if you have pneumonia. Number 10 is a pneumothorax, and this is actually where your lung collapses. If your right lung collapses, you're going to have severe pain and immediate onset of shortness of breath. Activate EMS. This is very common. Well, it's not very common. It's very rare actually, but it's most common in young men. Almost always it's someone who's still dumb enough to be still smoking. So if you're a smoker and you're a young guy, or if you're any age or any gender and you have immediate onset chest pain and shortness of breath, activate EMS. Number 11 is pericarditis or myocarditis. This is an inflammation or an infection in the lining or the muscle of your heart. This is going to kind of come on slowly, usually after you've had a upper respiratory infection, and you can have quite severe shortness of breath, chest pain. It could be on the right, left, or in the middle. EMS should be activated if you have this. Number 12 is a pulmonary embolism, and depending on which lung this happens in and how big the embolism is, you can have severe chest pain even on the right side. It's always going to be accompanied by shortness of breath and an impending feeling that you're gonna die. And you might die if you don't activate EMS very quickly for a pulmonary embolism. Number 13 is Castrochondritis. And this is a poorly understood inflammation of the cartilage and the rib matrix. And it can be pretty severe pain. And if you never had chest pain in your life, then you don't know really what severe chest pain feels like. Castrochondritis can come after an upper respiratory infection. It can come after the day after a hard day of working, moving boxes, working out. But it's almost always accompanied with a very sharp, very pointable, you can say, ooh, it's right there. When I take a deep breath or cough or touch it, it hurts. That's probably castrochondritis. I hope this video has helped you understand your right-sided chest pain better. As an old ER doctor, I will again caution you, if in doubt, activate emergency medical services. Even at 3 a.m. as an ER doctor, I never faulted someone for calling the ambulance for having chest pain. If it's your first bout of chest pain, you have no idea what's a heart attack, what's a pulmonary embolism, what's a collapsed lung, you don't know. Call EMS and let your ER doctor sort it out. And if they get upset with you for activating EMS, then that's his or her problem, not yours. If you enjoy my videos, please take a second and click that subscribe button and the little bell button right beside it if you haven't already done so. If this answered your question, click that thumbs up, not thumbs down, so that it'll help the YouTube algorithm reach other people so I can help other people understand their health even better. This is Dr. Barry. I'll see you next time.